Hi there, my name is Dr. Karen Hallam and I am a Senior Research Fellow at YSAS in Melbourne and also a clinical psychologist. The reason I'm talking to you today is for a really important element of the Therapeutic Alliance. Often we talk about the Therapeutic Alliance as just the relationship between the therapist and the person they're working with. In reality, it's actually a really nuanced and unique relationship that sets a person up for their recovery for many years to come. An element that I'm often asked about and people struggle the most with is how to set their boundaries with people. When we talk about boundaries, we mean a whole range of different things, but often the thing that's most challenging is personal boundaries. I have a really simple way of trying to understand that concept of personal boundaries, and it comes from the work of Hallam, who's a great existential and humanistic therapist. When I think about it, I think of three circles: the largest circle, a moderate-sized circle, and a circle right in the middle that's very small. The largest circle is what we call the here and now. The here and now of the therapeutic relationship is the good stuff. It's the talking in the room about somebody's experience of being helped. It's about talking about the issues that have come up. It's about talking about their experience of how you are as a therapist as well. It's also you giving them direct feedback and letting them know what is and isn't appropriate in the settings that you're in. Finally, here and now gives you a chance to talk about their experimentation with behaviour. What if they tried something different? You come back to the session, you talk about how it went. Here and now is always energetic, it's always exciting, and it's a great opportunity to actually see and feel how this person interacts with others. There's that middle level of disclosure as well, and this is just what we call the fellow traveller self-disclosure. This notion of the fellow traveller is about 50 or 60 years old, but basically says, I'm a human, you're a human, we're in this room together. We're talking about hard stuff, but we're still just people. So when somebody asks me if I have a dog, I say yes. I tell them what my dog's name is, I tell them what breed. I ask them if they have a dog. They might say yes or no. They say no, I might ask them if they want a dog. What would be good about having a dog? Do they like petting a dog? Does it comfort them? Do they learn anything from their dog? What type of dog would they like? That might tell me about their personality. Likewise, if somebody says, have you been to the latest Avengers movie? I'm going to answer them. What's the cost of not answering? Very little. They don't learn anything much about me. They don't learn anything inappropriate, but they get an opportunity to just see how human you are. The last level is very, very small, and this I call Here Be Monsters. This is personal disclosure. This is talking about your own life. There's a big temptation to talk about your own life when there's some similarities between your experiences and somebody else's experience as well. My warning about this type of disclosure is not that you could never do it. Sometimes it might be appropriate, but I'm going to give you some reasons not to do it and to find a different way in the here and now or in the fellow traveller ways. Some of the reasons not to self-disclose are because it starts to blur the boundaries between what is a therapeutic relationship and what is a personal relationship. When they get to know you personally, often people protect you. They take care of you when perhaps you don't need to be taken care of. They might stop telling you things that would disappoint you. They might stop telling you things that would upset you. They might stop sharing if they are not doing so well, which is a real difficulty because we want people to be honest. Likewise, they can get really upset with themselves if they don't cope with the problem as well as you coped with the problem. They compare themselves to you. This also sets people back. And finally, if they feel that you're judging them or that they're not performing for you well enough, they're very likely to disengage from therapy or become really angry in therapy. There's lots of reasons not to self-disclose and only a very few to do it. I would always encourage you, if you're about to self-disclose something, to really ask yourself, am I doing this for me or am I doing this for them? If you answer the former, maybe, I again encourage you to think a bit more about it because there's so much more that could be done with a fellow traveller statement or a here and now statement. So they're my three ways of thinking about self-disclosure. None of them are hard and fast rules, but they're the ways that I go through my therapeutic experience and find that I do my very best work with young people.